Yeah, so Port Hardy's a really interesting place. It's like true old Vancouver Island. It's a really interesting place, you know, people work really hard. It's very remote and isolated, so it's a very tight community. Everybody knows everybody else, smaller and very community focused, but a place where I could practice true full spectrum family medicine.
With two young boys, life is crazy anywhere you might be. It's been nice being here in Port Hardy. We are just a few minutes walk away from the waterfront, from the beach, and so that's often a destination where we walk with them there and then they can play on the beach, and that's been really nice. We don't have to really drive anywhere to get to cool locations.
Our patient population, I would say, definitely skews young. So we have, like, compared to a lot of the rest of the island, we don't have that retirement community vibe up here. Like, we have young families, high birth rate.
It's interesting to watch over the last 10 years. So there's a big influx of younger professionals. We're starting to see like a workforce change in terms of the balance in town.
We bond through struggle. It can be really hard to work up here because it's so resource limited. So the team becomes so important, and everybody who works up here knows that, and it's my favorite thing about working up here.
Yeah, we all get along really well. That's been something that's really nice that since we've been up here, and it's been one thing that's been a positive that's kept us up here, is the environment at work. It feels good to go to work.
But our superpower is knowing each other and our ability to integrate, to do quick turnarounds, and to be able to come together. That really matters. So I think that's something this community has a real strength in, and if we continue to work with that, that serves people's personal lives and professional lives, and it's actually our jam when we do it well.
Yeah, it's been very rewarding to hear people's experiences and to get to know them. I really like that.
I have learned to really love those small moments of practice, which you can't get anywhere else. You can't get that as a locum. You can't get that as a specialist because the patients are in and out and gone. That's like a privilege that's only for family doctors, and I have really learned to appreciate that.
For the last 4 years, when people ask us about how living in Port Hardy is going, I'd always say, you know, it's been a great work-life balance. Something that plays into that is like a 5-minute walk to work. That's my commute. I don't have to sit in a car in traffic for a long time, and I can come home for lunch, which when the kids weren't in daycare, that was, you know, I'd come home and help out at home with the kids and see my family, so that was really nice.
I think the kind of person who would do best in Port Hardy is somebody who really values a strong team, who really loves medicine, loves doing good medicine, somebody who's quite resourceful, somebody who likes being in nature every day.
If you want to be at a place where your practice actually matters and creates a big impact in an overall shift in healthcare, if you want to be in a place where teams pull together around the betterment of care, where it's small enough that you can get things done, but large enough that you're not the only person in charge. And if you're looking to have some life outside of work where you can do something without being in traffic and hustling all the time, well, it'd be the place to be.